Topic of the lecture today is trichinellosis. Now, trichinellosis means any kind of infection caused by trichinella or any kind of pathology caused by trichinella or inflammation caused by trichinella. So, what is trichinella? Trichinella is actually a nematode. It's actually a subclass of nematode. It's actually a whole class of nematode called trichinellas. They're also known as roundworms. You all must have heard that name. Now, roundworms are parasites. These trichinellas are parasites. This whole topic, this whole trichinellosis depends upon this parasite. Now, we call them parasite because they depend upon us. They live inside of us, they use our body, they propagate there, and they somehow use even our energy processes. We call them parasites because they feed on us. So trichinella is actually roundworms which go into our intestine, and they don't even stop there. They go into our muscles, they get deposited there, their larvae get deposited there, and when they're adult, they come back into the intestine and we defecate them. Then the life cycle continues. In this lecture, we're going to talk about your life cycle too. So first of all, what I would like you to see is trichinella. Now, trichinella is actually a roundworm, as I told you. Now, if you look at this slide, you'll see them whirling around themselves. That's why they call roundworms. That's why they call trichinella. Now, in this slide, as you can see, some of them are very small, some of them are very large, some of them are more circular in nature than others. It depends upon their size, it depends upon their age, it depends upon at what stage of maturation or at what stage of development they are. But most of them, whenever you look at them through microscope or through any other kind of modality, what you will see is a structure, is an organism, is a parasite which will be whirling around itself. It will fold itself on itself, and it will give you a round appearance. That's how we call them roundworms for our convenience. Now let's talk about the life cycle, shall we? In the life cycle, what is a life cycle? Life cycle is through what stages or through what modalities or through what other organisms or animals or humans this organism will go through to complete its maturation, to complete its propagation, to complete its life cycle. So it has basically two life cycles, right? But before we go on to those life cycles, let me tell you, it's mostly found in what? It's mostly found in rodents. It's mostly found in rats. It's mostly found in pigs. It's mostly found in bears. These four are most probably going to be the home of this parasite. But there are two life cycles. One, we have this Sylvatic life cycle in which predation and scavenging will come through. What is predation? What is scavenging? Predation means that one animal is prying on the other animal. It's a life cycle. For example, cat is going to eat mouse. It's life cycle. It's scavenging. It's predation. Just like that, a tiger is going to eat zebras. So it's a life cycle. It continues. In that life cycle, every animal has got some predators, has got some prey. So in this parasite, in the meaning of this parasite, in the true nature of this parasite, what happens is that this life cycle, whatever will eat that organism, whatever will eat that animal which is harboring this parasite is going to get that infection. It's just that simple. So what happens is that we have these four options. It can be rodents, it can be bears, it can be pigs, and it can be rats. They can also be present in the cats too. So, but these four are basic homes, or you can call them stay safes of this parasite. So what happens is that they are deposited in these pigs, they are deposited in the muscles. They are deposited, and basically when you'll go for the autopsy of those mussels and you'll try to look at them, that okay, I'm going to see a roundworm. No, you'll not see a roundworm. You'll see a larva embedded in that mussel, larva embedded in that striated mussel. So what happens is that these larvas are going to be there until their maturation. When they're matured, when they're adult, they're going to go back into the intestine and they're going to go cause that infection again, and they get defecated, and this life cycle continues. Whatever will consume or will get in contact with that defecation or will get in contact with those feces will get this parasite one way or another. So after looking at it, what routes or what modes of transmissions do you think will harbor? What modes of transmissions you'll think that, okay, we are going to get this infection through this mode of transmission? There's only one mode of transmission for us humans. If we eat these animals, I told you, when we go for scavenging, when we go for predation of these animals which are harboring this parasite, what's going to happen? We're going to kill them and we're going to feel accomplished that, okay, we went on this and we got an animal. But if you don't properly cook that meat and it's undercooked, this parasite, the larvae of this parasite are going to be there and they're going to get inside your system. And once they get inside your system, it's not very easy to take them out. So what happens is that in predation and scavenging, these animals are actually eating each other. So they are getting this parasite from one another and harboring this parasite inside their body. Now this is the proper life cycle of Trichinellosis or Trichinella. So what happens is that they keep eating themselves and they keep harboring this parasite in their striated muscle, in their body. So whenever a human will get in contact with their feces, number one. Number two, whenever a person eats an undercooked meat of those mussels which harbor their larva, which harbor the larva of Trichinella, when we eat those animals, when we go for a barbecue or eat them, what will happen? If it's undercooked, you are actually putting these larvae into your stomach, into your body. You are actually helping them invade your enteric system. So let's talk about it. This is what's called domestic cycle, or we call them meat scraps, or we call them cannibalism. What is cannibalism? Cannibalism is eating each other. There are certain people who eat the human, that they are called cannibals. That's what's called cannibalism. So what happens is that in domestic cycle, either we eat those meat scraps which harbor these parasites, which harbor these pathogens. When we eat them, they get into our enteric system, they cause us infection. Or it can be because of cannibalism. For example, a patient was suffering already, a person was already suffering from this infection, a patient was suffering from already this infestation, and we went on and we added this. We ate that person. We had that person's meat scrapings, and we are going to get this infection or infestation or pathogen, whatever you call it. So what happens is, most probably in the cycle of meat scraps, we are going to be eating either rodents, rats, or what? Pigs. Now pigs are 90% in the mode of causing this pathology, or if we're talking more what organism or what animal is the basic reason for us to get this pathogen. That's going to be pigs, because we're not going to eat bears every day, we're not going to eat rodents every day, we're not going to eat rats every day. Yes, but we do eat pigs, and that's why this infection is very low occurrence in Islamic community, because they don't eat pig, and it's most probably found in Western countries where they eat pigs on daily basis. And if it's not properly cooked, if it's not properly baked, we are going to get this infection. So in this domestic life cycle, we have this option of meat scraps. We eat undercooked meat of either pigs or rats, and their muscles contain their larvae. They are harboring their larvae, and we are going to ingest them. And when we ingest them, they're going to get into our enteric system, pass our stomach, and then go into intestine and start harboring themselves there. And then starts their proper stages of life cycle inside a human body. We're going to talk about it one by one. Next on, I just told you they're going to have these encysted larvae in the striated muscles. And when we consume them, we're actually helping them invade our enteric system. So this cycle continues. This cycle goes mostly from pigs to pigs or rats to rats. But if a human somehow consumes it, what will happen? This will happen. Ingestion of undercooked meat will get into our system, pass through our stomach, go into our intestine, and harbor themselves. Once they are in our intestine, what's going to happen? They are going to grow in size. They are going to grow in size. They are going to multiplicate. And once they multiplicate, they lay their larvae. Once they lay their larvae, those larvae are actually migrated towards the striated muscles. And which striated muscles would that be? Which striated muscles are at higher risk of getting invaded by these larvae than others? We have these deltoids, we have these pec muscles. These two muscles basically are going to be the home of these larvae. So they multiplicate, they advance, then they start reproducing, they produce their larvae. These larvae are migrated into our muscles. They get embedded there in those striated muscles like cysts. And afterwards, when they're maturated, when they're adults, they move on into the intestine again. As I told you, these larvae released in small intestine are going to migrate into the muscles, and when they're adult, they are going to come back into the small intestine. These larvae are deposited in the mucosa, and from there they are picked and brought into those muscles, and they are embedded in those muscles. So that's how it goes inside a human body. You ingest an undercooked meat, you're giving that parasite, that pathogen, that infestant an option to multiplicate inside our body. Once they get there, they multiplicate, they advance. If they go into an adult state, they're going to stay in that intestine and they're going to cause this infection. Otherwise, if they are multiplicating or they were just larvae, they're going to go and cross the mucosa and go into the muscles and get deposited there. And once they are adults, they're going to come back in the intestine. And this infection will go on, this infestation will go on, because there's no way of immediately knowing that you are suffering from roundworm infection. There's just no way. You're not going to have basic symptoms of it. You're not going to have symptoms like specific. You're not going to have specific one or two symptoms that, okay, I'm having this infection or infestation. You know about this infection, you know about this infestation rather very late than other infections. Because what you might be feeling in the start will be hunger or some aches. But what happened afterwards, we're going to talk about it. What clinical manifestation does it bring with itself once it reaches a certain stage? So this is the life cycle. Either it's Sylvatic cycle, in which bears, pigs, rodents, rats eat themselves, eat each other through this life cycle in predation and scavenging, and harbor these parasites, harbor these infestants. Or we can go into domestic cycle, in which we have these pigs and rats which can get this infestant from each other, and when we consume their undercooked meat, they're going to go into our intestine. If they're larvae, they're going to go and deposit into the mucosa. From there, they can go and deposit in the striated muscles, and once they're deposited in the striated muscles and they get into adult form, they come back into the intestine and causes infection. That's how this life cycle continues. That's what life cycle of Trichinellosis or Trichinella is. Now moving on to pathogenesis. Now, what is pathogenesis of this infection, of this infestation, of this parasite in our body? The basic pathogenesis is that it's going to involve our intestine. It's going to destroy our intestinal mucosa. It's going to get into our striated muscles. It's going to destroy the muscles. These two are basically the target organs or target tissues of this infestation or infection of this parasite. But what other basic organ gets affected? That's our brain. There have been multiple studies in regard to that, and after thorough researches, what we have learned that there's 0.2 to 52% chance of getting CNS involvement in this infestation. I know that's rather very high for a parasite. What's going to happen is that it involves your central nervous system in very different way. And in those researches, what we have learned is that these infestations, most of them get cured by itself. Most of them get cured by a treatment. But there's always a chance in which it does not get treated. It just gets worse and worse. And patients, 16.52% patients who got CNS involvement died because of it. So its involvement with the CNS system is not minor. It's actually a major involvement. So we have to know that through which processes or through which complete cycles it gets to our systems, it gets to our CNS system and affects it. So what happens is that we have this Trichinella larva, right? The start of everything. We have this larva, we have this Trichinella larva. So what's going to happen? It's going to have these toxic effects. Toxic effects how? Being a parasite, it has these toxic effects in which it will destroy everything that will come in its way, just to propagate, just to invade your body. So it has these inflammatory inflations or inflammatory infiltrations which will affect what? Which will affect your vessels. And when they're inflamed, they're going to get what? Obstructed. When your vessels are obstructed, when your vessels are inflamed, what's going to happen? Your blood supply is going to cut off. Your blood supply is going to be compromised. One way or another, you will have these blood supply compromisations. That will lead to what? That will lead to severe systemic manifestations. And then these larvae are going to migrate where? Into your striated muscles and start destroying those muscles. If you take a biopsy of a patient which is suffering from this infestation and you take a biopsy of deltoid or pec, you will see these larvae embedded in your striated muscles. So what happens is that it has its toxic effects and it has its inflammatory infiltrations which will affect your vessels, which will inflame them, and there will be occlusion of blood in the blood vessels. And severe systemic manifestations can come through. Blood supply can go down for a specific organ which require more of that blood. And if requirement is not met, what will happen? It will go into necrosis. It will go into ischemia. So it has these toxic effects. Next on, after the migration, we talked about larvae are ingested into our intestine, and from the intestine it's picked up and they're deposited in the mucosa, and afterward they get deposited in the muscles of our body, which are striated muscles, most probably like deltoid and pecs. What happens is that when they migrate, they're going to produce diffused lesions. Once they produce diffuse lesions, they also involve the CNS system through their diffused lesions, through their migration. Now those diffuse lesions can be where? They're not going to cause diffuse lesions in your muscles. In the muscles, they get just embedded. But once they have reached a stage in which their number, their quantity is too much, they are going to migrate to your brain. They are going to migrate to your brain. These larvae are going to get migrated to your brain. And in the brain, what will happen? They're going to cause diffuse lesions. And what will happen with these diffuse lesions? Wherever that lesion will happen, wherever that lesion will form, those areas of the brain will not function anymore. And if they are functioning, either they're hyperfunctioning or they're hypofunctioning. So that's how the CNS is involved, because of the larva migration to the CNS. They produce diffuse lesions. Those lesions affect our body because our mind is being affected. Those areas are supposed to, for example, if it's in those areas which control optic system, your optic system will go down. It affects your optic nerve. Your sight will go down. So wherever those lesions will be forming, the effects will be coming along. Just like that, this vessel obstruction can get the CNS involvement. If those vessels are obstructed and the blood supply for central nervous system is compromised, what will happen? We will have ischemia of brain. When we will have ischemia of brain, a major or a minor or whatever part is not getting the blood and the blood supply is compromised, and gonna go into ischemia and then necrosis, and those functions of the system or the central nervous system which were carried out by that part of the central nervous system will go away. You won't have those functions in your body anymore. You won't be able to control those functions in your body anymore. Just like that, we can have these inflammatory infiltrations, which can lead to meningitis, which can lead to other inflammatory infiltrations of the areas of the brain. Just like that, we have toxic effects. We talked about every parasite, every infestation have these toxic effects. They release certain substances and they can also lead to CNS involvement. So these larvae can get to our CNS system through 4 major processes. It has its own toxic effects. It has its inflammatory infiltrations. It can cause vessel obstruction and cause ischemia. It can migrate and cause diffuse lesion and affect CNS system. So through these 4 processes, through these 4 pathogenesis or pathological features, it can affect your brain. And if you just look at it, if your brain is has these diffuse lesions, it has a vessel obstruction, you will die, obviously. If it's at that stage, you will die. I mean, we were talking about how a parasite can lead to CNS involvement and death. That's how. That's how it leads to CNS involvement and death afterwards. So what happens is that with these infestation, with these infection, what comes along? Our body responds. Our body responds in different ways. Our body is going to respond with eosinophils, with interleukins 5. Our body is going to respond. When our body is going to respond, it's going to cause what? These eosinophils are going to go into infiltration and deregulation. That will lead to what? Vascular damage. If eosinophils are infiltrated or deregulated, they're going to cause vascular damage. Now that vascular damage will also move on with this. There's obstruction, there's damage. There's more and more destruction going on, and this will also lead to CNS involvement. If vascular system is being damaged, if your blood supply is being compromised, your systems are going to go down. And when that vascular area supplies supply your brain, obviously it's going to cause CNS damage. We have these immunological reactions which will damage the vascular area because we have these infestations, we have these infections, we have this pathogen. Immunological reaction will come through. What happens in immunological reaction? Remind me. Inflammation of the vascular areas. So inflammation will come in and then damage will come in, and when all of that damage will be happening, it will one way or another will lead to decreased blood supply, to compromise on the blood supply of the brain, and that will lead to CNS involvement. It can lead to directly CNS involvement and it can lead indirectly into CNS involvement. One other thing that gets secreted, one other thing that gets produced is tumor necrosing factor alpha, TNF alpha. Now, this is also a response of the body. So what happens? This TNF alpha, if it's in more than normal ratios or levels, it's also going to do what? Endothelial damage. And that endothelial damage will get in with vascular damage. Now, TNF alpha, if affects the endothelium, it will lead to vascular damage. Immunological reactions will lead to vascular damage. Just like the immunological reaction that were affecting the vascular areas and causing vascular damage and causing CNS involvement, they had this indirect relationship. And they also had this direct relationship. If immunological reactions are too severe, they're going to involve the brain. Just like that, TNF alpha has also these neuronal damages. It does not only affect your endothelial system, it also affects your neuronal reactions, your neuronal system, and it also affects your neuronal areas and cause neuronal damage, and through that it has this indirect relationship with CNS involvement. So up till now we have learned that these larvae are going to cause some toxic effects. So what are those toxic effects? These immunological reactions, these endothelial damages, this tumor necrosing factor alpha. This is actually a body reaction. Even our body is not helping us in this matter. They are producing those substances, they are producing those chemicals which are also affecting our brain. And then we have these inflammatory infiltrations, vessel obstructions, which will be helped through what? Which will be helped through eosinophils deregulation and infiltrations. That vascular damage will come through endothelial damage through tumor necrosing factor alpha, and immunological reactions will also affect the vascular areas and cause vascular damage. And that's how these vascular or vessel obstructions will come through. And then these migrations and diffuse lesions in the brain will also be responsible for the pathogenesis regarding the CNS system. But keeping in mind that most of those patients which even got to that level can be cured, can be given treatments. We're going to talk about different options of our different options for the treatment. But what we know is that most of those patients can still be cured unless they don't have these diffuse lesions, they don't have these vascular damages up to certain levels that it causes brain ischemia. It can still be prevented. But if it reaches up to that level, if it gets to that level, there's no way going back, because it has embedded everything in your body. It's in your muscles, it's in your brain. What else there is to infest? Next on, we have stages of infection. We talked about its life cycle in the human body, right? We talked about how these larvae are going to go into our enteric system. From there, they're going to migrate into your muscles, and from there, when they are adult, they're going to come back into our intestine. Let's talk about it. First of all, we have this enteric invasion. Enteric invasion will come when we ingest the undercooked meat, when we go through the undercooked meat. So they're going to invade our enteric system. They are in the larva form, most probably in 80% of the cases they're in the larval form. They're going to get into our enteric system through ingestion of undercooked meat. Next on, we have larval migration. Now these larvae are going to migrate. Migrate where? They can migrate anywhere, but most probably they're going to migrate into your striated muscles, and they get embedded there like cysts. Next on, muscle and cyst will come through. These larvae are going to migrate into muscles and cause cysts there, and they get embedded there. That phenomena is called muscle encystment. Now these three are the stages of infection, not the stages of propagation. Infection meaning they are still making their way into our body. They got in, they migrated to your muscles, they got encysted there. That's their stage of infection. Once they got there, you are infected. They're not into your just entire system anymore. You are infected with this pathogen, with this infestant. From there, it will just propagate. From there, it will just multiplicate. From there, the worst comes. Now, what are the clinical features of larval migration? Not infection, larval migration. It can be in muscles, it can be in brain causing diffuse lesions, it can be anywhere in the body. In some cases, it can go into your eyes. So let's talk about it. Local 6 systemic hypersensitivity reactions. What are local 6 systemic hypersensitivity reactions? You will have what? You will have all of these hypersensitivity reactions that we have talked about in different lectures. What are those? You will have flu, you will have cough, you will have redness, you will have inflammation, you will have redness of the eyes. All of those will come in. Why? We talked about it. Eosinophils are being affected badly. You are going to have these local 6 systemic hypersensitivity reactions. Next on, we'll have hypereosinophilia. We talked about body thinks it's an infection, it's an infestation. You are getting these hypersensitivity reactions because eosinophils are rising. But what happens to those eosinophils? They get deregulated. They get infiltrated. Next on, you will have this periorbital and facial edema. Periorbital and facial edema because of basically this hypersensitivity reaction. In 80% of the cases, that's the reason of getting periorbital and facial edema. Next one, you will have hemorrhages in the subconjunctiva, retina, and nail bed. I told you they can migrate even to your eyes, into the back of your eyes, and they can infect and they can actually destroy these structures and lead to hemorrhages in the subconjunctiva, retina, and the nail beds. Nail beds are not obviously connected with the eyes, but what happens in the eyes is that it causes hemorrhages in the subconjunctiva and retina. These two are the basic structures that get affected in your eyes. These are the two basic structures that get embedded with this pathogen, with this infestant in your eye, subconjunctiva and retina. Further on, it can go into your nail bed and infest itself there. Next on, we have maculopapular rash. Maculopapular rash will come through because of these hypersensitivity reactions we are having, because of this infestation we are having, because of this infection we are having. We'll have these maculopapular rashes. Next on, you will have headache. If it's migrating towards your head, if it's migrating towards your brain, you're going to have headaches because it's causing diffuse lesions there. Because it's affecting your CNS, you're going to have headaches, obviously. You are going to have cough and dyspnea. Because if it gets migrated towards your lungs and cause pathology there, you'll have these coughs, you'll have these dyspneas, in which you won't be able to even walk steps in a faster speed. Next one, you will have fever, you will have dysphagia. Fever because of this infection, dysphagia is because of what? Dysphagia is because of these infestations which your entire system is harboring. You'll have myocarditis with tachyarrhythmias or heart failure. It can go into your heart, it can affect your heart, it can lead to myocarditis, it will infiltrate your myocardium, cause its inflammation, tachyarrhythmias will come through, or patient will go into heart failure if it's severe in nature. Next on, you'll have encephalitis or pneumonitis in your lungs if it infects or infestates your lungs. So what we are going to learn, what we have learned in this slide is that what are the basic areas these larvae are going to migrate themselves into and cause infection. And those clinical features will come on the basis of these larval migrations. If they have migrated towards your skin, basically, you're going to have what? Maculopapular rash. Now, maculopapular rash can also be because of hypersensitivity reactions which are happening. But basically, if it infects or infestates your skin, you'll lead to maculopapular rash. If it's involving in your blood, if it's disseminated, you're going to have hypereosinophilia and these local systemic hypersensitivity reactions. If it goes into your eyes, you're going to have what? Hemorrhages in the subconjunctiva and retina, as well as nail beds. But what happens with periorbital and facial edema is that either they have infestated and infected this area, or you are having these symptoms because of what? Hypersensitivity reactions. If it's migrated towards your head, you're going to have diffuse lesions, you're going to have headaches, you're going to have cough, dyspnea, encephalitis, and pneumonitis. If it's migrated towards your lungs, you will have these this myocarditis and tachyarrhythmias. If it has migrated towards your heart, if it has made home into your myocardium and causing this inflammation, and you will have this fever and dysphagia once this infection, this infestation has built up in your body. So the clinical features totally depend upon the area of the larval migration. Next on, let's talk about the clinical features of larval encystment in the muscle. Right? Up till now, we have talked about if it goes into your brain, what happens, if it goes into your lungs, what happens, if it goes into your skin, what happens. But the major tissue which gets affected with this infection or with this infestation is our muscle. So let's talk about muscles in the very specific. what happens is that the clinical features of muscle involvement will be myositis with myalgias, muscle edema, and weakness. Now, these three are the key features of larval encystment in the muscle. These muscles, I told you, these muscles can be any one of our body's muscle, any one of them. But basically and predominantly, we get these pecs involved, we get this deltoid involved. So what's going to happen is we're going to have this myositis with myalgias, with pain of the muscles. Myalgias are pain in the muscles. Muscle pains will come through. You'll have this muscle edema. Muscles will be inflamed because of this larval encystment there, and you will have weakness because your muscles are down, your muscles are infested, your muscles are infected. You're not going to have that optimum muscle activity or capacity. So you will have weakness, you will have fever, you will have arthralgias. So these three are the clinical features of larval involvement with the muscles. Next on, how will we know that this patient is suffering from this infection or infestation? There's a whole method of it. You don't just have to jump into laboratory findings and diagnosis. I always tell you with any infection, with any infestation, the key to getting to your diagnosis is your history. You start with history of the patient. In the history, you'll ask what questions? You'll ask certain questions regarding his appetite, regarding his consumption of the meat, regarding his past involvement with the barbecues, with something like that, with the pig, if he has gone into this undercooked meat, or has ingested undercooked meat, or with some friends he ingested some things which contain larvae, or he ate a bear. This kind of history will help you in reaching to your differentials. That okay, there's a history of eating the undercooked meat or consumption of undercooked meat, or going for the prey, or going for hunting these animals like bears, rats, or something like that. So these history points are very important for you to get to your differential. Otherwise, what will you have? You will have eye involvement. You will send him to ophthalmologist. That okay, have a look at it. He'll have sinus involvement. You will send him to neurophysician or neurosurgeon. You won't know that this patient is suffering from only parasite infestation. So history is very important. You'll have to go into history in detail. After that, what will you go for? In the history, you'll say, have you had any contact with the feces of any person which has been suffering from this disease, or any person in your home is already suffering from this disease? You'll ask about the context of that person. You'll ask about the consumption of different kind of meats. You'll ask about the consumption of different other foods which contain meat, which can be undercooked. You'll ask about the history of any animal contact in that manner too. After that, you'll go for the examination. You'll go for the muscle examination for the first. After general physical examination, you will see the muscles. If that person is suffering from myalgias, because muscles are the primary target organ of these larvae. So muscle edema is going to be there. Muscle pains like myalgias are going to be there. So you will reach further into your differentials, further into your diagnosis. Once you are done with all of these, once you know that, okay, it's not a neuronal involvement, okay, it's not only a bone involvement, only not a muscle involvement, it's actually a combination of all of these, you will suspect this parasite infection. Once you suspect this parasite infection, then you'll go for these laboratory findings and diagnosis. So first of all, you'll go for what? You'll go for the blood report. That's general, that's for every disease. And in that, you'll specifically go for blood eosinophilia. And what's going to be there? Increased number of eosinophils. Next on, you'll go for the creatinine phosphokinase levels, which will be elevated because of this infection and infestation. Next on, you'll have this rise in the titer of parasite-specific antibody, PSA. Most of the times, whenever you will be studying parasitology, you will be hearing about PSA. PSA is actually parasite-specific antibody which our body produces in response to this infestation of parasite. So rise in the titer of PSA means that there's a parasite present and body is responding to it by increasing PSA antibodies. Surgical biopsy of at least 1 gram of involved muscle. Now, I told you most of the times it can be any muscle in your body, but primary targets are your deltoids, your pecs. So most of the time what we go for is biopsy of the deltoid. There should be 1 gram biopsy of the deltoid, and once you see it in a microscope, this is what you'll see. These roundworms, these larvas of the roundworms is what you'll see most of the times. Next on, you'll go for the routine histopathological sections, and you'll see roundworms or their larvae present there. So these all laboratory findings will help us in reaching our definite diagnosis. Now, in the biopsy, what you'll see, you went for the biopsy, what you'll see, what are you expecting in the muscle biopsy? A whole grown organism? No, we talked about it. Larvas are going to be there. Larvas, this is larva of roundworm. These are going to be embedded in the striated muscles. That's what we call larval encystment in the muscle. So what you'll see in that muscle, in that biopsy of the muscle, is a larva embedded in your striated muscle. That's going to be your definite diagnosis finding technique. Now let's talk about the treatment options. What treatment options do we have for mild infection, for moderate infection, for severe infections? I told you that most of these cases get treated. Most of these cases don't go into a further stage. We treat them, and afterwards they don't get this infestation or infection again. So what we have is that in this trichinosis, we have 3 different substages. Either it's a mild infection, either it's a moderate infection, either it's a severe infection. For mild infection, we give supportive treatments. In supportive treatments, we treat what? We treat the symptoms, we treat the signs. We give supportive treatments, like if the patient is having muscle ache, you're going to give treatment for that. If patient is having muscle edema, you're going to give treatment for that. If patient is having periorbital puffiness or hypersensitivity reactions, you give treatment for that only, nothing more than that. But if it's a moderate infection in which infestation is there, in which infection is there, in which involvement of other systems is there, you give albendazole. Now, albendazole is given the dose of 400 milligram, which is given 12 orally, BID. So BID treatment means that you'll give 12 orally like 6 p.m. or 6 a.m. for 8 to 14 days. But there are some patients which don't respond to this therapy, or some patients are sensitized toward albendazole. They get this hypersensitivity reaction because of it. So we give those patients mebendazole, which is given in 200 to 400 milligram TID. For how many days? For 8 to 14 days again. The whole treatment, the whole course of the treatment must be between 8 to 14 days. So what happens is that mebendazole and dasthen, both of them are given in 400 milligram dose, but 8 orally, not 12 orally, 8 orally. They're given 3 times a day. Then we have severe infestation or infection, in which we do this treatment, in which we give either albendazole or mebendazole and dasthen, but we add glucocorticoids. Now, in the glucocorticoids, we give prednisolone, which is given 1 milligram per kilogram QD for 5 days. What does that mean? 1 milligram per kilogram. For example, my weight is 70 kg. I must get a dose of 70 milligram QD, meaning 4 times a day. It means that I'll get this dose 6 orally, like 6 p.m., 12 p.m., 6 a.m., 12 a.m. I'll get this dose 6 orally 4 times a day. So you have this albendazole and glucocorticoids coming along, or mebendazole and dasthen and glucocorticoids coming along. So that will be the treatment of severe infection or infestation of Trichinella. So that's all for today regarding trichinosis. We learned about what trichinosis is. It's caused by Trichinella, which we also call roundworm. It's a parasite. It gets into our system through not properly cooked meat. When we ingest it, it gets into our entire system. It gets deposited there. Then it migrates, and then that migration is kind of tricky. Wherever it will migrate, the clinical features will be regarding and according to that migration. If it's migrating toward your muscles, you'll have these muscle ache, you'll have these muscle edema. If it's migrating toward your eyes, you'll have these eye involvements like periorbital edema, puffiness, and then conjunctival involvement, and then retinal involvement. And if it migrates to your brain, you'll have these headaches, you'll have this diffused lesions. If we go for radiography, you'll find diffused lesions in your brain. So all of the clinical features will be depending upon the larval migration. Afterwards, we talked about how do we diagnose the patient. We diagnose the patient on the basis of history, on the basis of examination, on the basis of eosinophilia, and on the basis of biopsy. And what confirmative tests we have? We have the biopsy and then histopathological section. And then we have these treatment options. If the patient is not suffering from severe and chronic disease, most of the cases patient gets treated. If the patient is suffering from very severe disease and multi-organs are involved already, in which CNS system is there and your cardiac system is there, then you only give supportive treatment. So that's all for today. Thank you for watching sqadia.com.